peak of the hour, I want to take the pleasure to welcome all of you on this session and to welcome you back from Addis Ababa. Those of us who were able to be in Addis Ababa, welcome. And the bits of what work remained to be done. I know we will, I think, hint on this at the end of the session. I hope we are continuing to finalize our action plans. But otherwise, thank you very much for that very dramatic session, meeting that we had, and lots of discussion. Lots of productive discussion that we had. So, as you understand, that our community is a lab system strengthening using viral load as a case. And when you look at viral load cascade right from patient, right from identification of the patient to the point of getting the results back to the patient, is a cascade of many things, which put together creates, it's a system. It's like a chain that has to be connected to get a service ultimately delivered, from patient identification to delivery of results to the patient, and effecting the necessary patient management guided by those results. Is a chain of events that must connect with each other in a system way to deliver the service. So looking at the viral load chain and cascade is one way to look at the entire laboratory system building. So within that cascade of events, there are underlying system issues that are in the background. And part of these system issues in the background is the quality. Because we cannot have, if we cannot have quality results, we may not be able to actually have these results impacting patient care, or these results being good to effect patient care. So the quality of the results that are being generated is as critical and as important as every other bit that we do in getting those results. If the results are not of good quality, they mean nothing. All the efforts that have been put in are worth nothing. They can actually be more harm than good, because they mislead, they misguide the management that the patient is supposed to. So quality is a system issue that is embedded within the underlying chain of events, but it is very critical. So quality is not a lab thing. Quality is from the point in the cascade of events, from the point of identification of the patient, including the counseling you provide. There should be a quality element into it. Otherwise, if you don't provide good counseling and relay it very well and give the appropriate information, you may not get the ultimate outcome that you want to see. So quality is a cross-cutting issue. Now we are going to look at it in terms of the lab, but the same principles apply across the board. So as we share quality within the lab perspective, let all of us, the clinicians, the civil society, and all other stakeholders look at the quality element of what we do. The civil society, there is a quality element of how you communicate with your community members and make sure you bring them to understand how important all the services are and ultimately how those services would improve their quality of life. So today we are going to be talking about this system issue called quality, and we are blessed and delighted to have subject matter experts to share the experience. We are going to have Mr. Anafi Mataka giving an overview of the quality system or the quality efforts being spearheaded by SLM, knowing that SLM is a community, is the organization that advances laboratory medicine. It has a quality component, a quality program. It is pushing through countries, and we want to know how far that goes. And then we shall have a case of a country case of the quality system effort. That is, Ethiopia will be sharing an overview of their quality system effort within their laboratory landscape. So I welcome Mr. Anafi to have the first slot. Anafi? Hello, Anafi?
Hello, can you hear me?
Yes, we hear you now.
Wonderful. So let me share my slides. Can you see my...
Yes, we see, but not from the first slide. Okay. You are the first slide, put it, okay. So you can start.
Okay, wonderful. Thank you, Charles, for the introduction. And just to reiterate what Charles has said, I think the ASLM LabCoP is bent on strengthening lab systems for the better for better health outcomes. So we have looked at so many topics thus far, and we hadn't really looked at quality in the laboratory. And this is a befitting session indeed. So the title of my presentation is Laboratory Quality Management Systems to Support Better Patient Outcomes and the Need for National Laboratory Quality Programs. So just to begin, what is quality? Just also acknowledging the diversity of the audience and why is it important? So the concept of quality dates back into history. The quality movement can trace its roots back to medieval Europe, where craftsmen actually began organizing unions and guilds as far back as the 13th century. And they were actually responsible for developing strict product rules for service quality. And they actually had inspection committees enforced the rules by marking flawless goods with a special mark or special symbol. So in healthcare, that still remains the same, and there are so many definitions for quality that we can apply. Maybe the simplest would be, it simply means something that is fit for purpose, doing the right thing at the right time, actually giving what the customer wants, freedom or from deficiencies, or conformance to standard. And I think most of the time we associate quality with the value and worthiness in terms of money or something like that. But for us to have quality systems that support better outcomes, we need quality diagnostics. And what is a quality diagnostic? It's usually one that is reliable, timely, and fit for purpose. That can actually be used for appropriate clinical management and public health action, and really resulting in favorable health outcomes. So if we look at the concept of HIV, quality laboratory diagnostics could mean a quality HIV viral load result that is actually timely and can be used for actually proper management of the HIV patient receiving ART, being taken to the appropriate model of care, whether it's a less intense model or actually being switched to other models. And the favorable outcome could actually be progress towards the third 90. So when it comes to quality, quality comprises several components and several implementation of in the laboratory. And the international standard for quality of clinical laboratories is ISO 15189. That is used mostly to either gauge the competence of the laboratory, or it can also be using to confirm or recognizing that laboratories meets the needs of the customers, the regulatory authorities, and accreditation bodies. Just looking at quality in general, the basic component at a minimum of any type of laboratory should start with the ability to give a correct result. And here we see the concept of quality control being very important. Usually at a minimum level, a lab should be able to give a result that is correct by measuring, by ensuring that internal controls and equipment maintenance is done accordingly. Then we can move to another level where we are talking of quality assurance. Are we saying the labs having measures to prevent errors or to ensure that quality is in place? Here we have the concept of external sort of quality assessments coming into play as well. We also then graduate as we move further to have a system, quality system, where we are now talking of leadership and responsibilities really coming through, coming into place, and activities are being documented. So for example, you find the lab quality manual, the lab decides to have a vision, mission, and conducts audits. And you would realize that when we're talking of a system, we have this loop where the lab is able to test, identify its gaps, and be able to improve on them. And then ultimately, when a quality management system is in place, we have systems for continuous quality improvement. And here we are now talking of working towards accreditation, and we have systems such as SLIPTA audits to benchmark, which I'll talk about, and how to move towards establishing a quality management system. But when you talk about quality, you are going to quality management systems, you are going to really touch on a number of system issues. And that's why I think quality management systems are very important when it comes to strengthening life systems. Implementing QMS allows you strengthening across so many issues, which we normally call them quality system essentials. But of most important, if you come back to layman's terms, you really talk about how timely the results are. Are we having sufficient workforce? The safety issues, equipment maintenance also coming through. So talking about quality, most of the time we tend to think of accreditation being as a measure of quality, but this is not the end point. Regulators, of course, rely on competence of laboratories to deliver results on which important decisions are made. Accreditation actually enhances the public confidence in those test results. And increasingly, regulators and suppliers require lab results to be accredited. However, usually when labs go for accreditation, it's usually a pass or a fail. And sometimes it may not recognize all those efforts that would have been done as labs are working towards this. And sometimes this can be demotivating. And this is usually a costly process. So that's why the whole Afro launched the SLIPTA process to be able to recognize those efforts towards ultimate quality by recognizing those step-by-step implementation. And ASLM implementing SLIPTA has been largely supported by donors, which is good for ASLM. One of ASLM's strategic pillars is actually quality amongst those other four. And for almost a decade now, ASLM has been implementing quality management systems through the rollout of SLIPTA. But you would also realize that SLIPTA is a checklist that verifies how far the quality management systems have been implemented. You find that there is usually a baseline audit that is done. with certified auditors that come into the country. An action plan, post-audit action plan is developed, and corrective measures and actions are taken. And tools such as SLMTA and other mentorship programs are actually used to support the facility. And a follow-up baseline audit will be done. So as labs graduate, they go through these gradual stars, depending on their score, ultimately working towards accreditation. Apologies here, I think the animation didn't work out. But the end point, really, what we are trying to push is labs as they go beyond those 3, 4, 5 stars. We want to push them, they will start preparing for accreditation. But this requires continuously implementing QMS and tools such as LKSI and the laboratory quality management system. Tools have become very important. You would realize that really this can be a resource-consuming exercise as well. So you find that there are really quite a lot of tools that are available there, not only SLIPTA and SLMTA, that can be used as we move towards implementing quality management systems towards accreditation. You have the LKSI, the GLI tools also specific for TB, as well as for the laboratories as well. So how far have we implemented QMS in the continent? This is found on the ASLM SLIPTA website. You find that in 2014, only about 15% of the labs that were accredited came from the rest of the world, yet South Africa claimed the bulk of the labs. But then as the movement continued, another survey that was taken in August 2019 shows that really the number of labs that are accredited outside Africa has actually doubled. And this has been tremendous results indeed. We have continental success. Of course, SLIPTA has played a role, as well as other mechanisms as well. We have global perspectives that has shown that this process is working. We also have country and regional implementation evidence, implementation in a single lab, as well as mentorship programs that have actually shown results. But despite this progress, you will realize that only a few laboratories have been engaged. This graph shows the rollout of labs under SLIPTA in quite a number of countries, and those out of the total number of labs that are in the country. And you realize that the blue bar shows SLIPTA out of the total number of, this is only public labs, excluding private labs. And as you can see, none of the countries have really reached above 50%. And that is quite low coverage. Is this low coverage really, I think, cannot impact patient outcomes when it comes to HIV as well at national level? What happens to other tests that need to be supported by HIV and TB programs? Some could be from HPV, even chemistry. Is this acceptable for communities to receive clinical results that are not quality assured or that have no proof of quality assurance? So what should we really be doing as countries, partners, policymakers, and those that probably has means of funding? Indeed, not all labs should really ultimately go for accreditation. At national level, countries should determine that while accreditation may be necessary or needed for higher tiers, sometimes less stringent standards are needed for lower tiers. For example, at a low rural health center, maybe basic QMS, which could probably just mean performance of selected EQA samples, could be sufficient. And as we move up the ladder, district hospitals and some provincial hospitals, probably we need to be thinking of certification. Maybe a lab should maintain a certain number of stars on the SLIPTA scale. Could this be based on SLIPTA? That is also one possible option. Some labs at the higher level could actually be earmarked for only national accreditation, while national reference laboratories in some central labs could actually be earmarked for international accreditation. So as I try to wind down, we are saying donor-driven facility-based QMS needs really to transition into quality programs that are at national level for sustainability if we are to meet the challenges of the 1990, as well as universal health coverage and health security on a broader scale. And if indeed, if we are to impact patients across countries and across laboratories, quality needs to be put in all the labs and not just labs in higher levels as well. So countries really need to take the lead on setting adapted standards for each tiers and for making sure that each lab is engaged in quality management depending on the tiers. So we today are glad and also honored to be having our Ethiopian colleagues, and I would like to introduce Habtam Asrat, the Laboratory Quality Improvement and Accreditation Team Coordinator, National Laboratory Capacity Building Directorate of the Ethiopian Public Health Institute. Habtam has 18 years of work experience in the laboratory sector and holds an MSc in Diagnostic and Public Health Microbiology. And he'll be presenting on what Ethiopia has done to try and move the agenda of quality management systems to impact patient care at a national scale. Thank you. Over to you, Charles.
I was on mute, sorry. Anafi, thank you very much. Please remember, if you have any questions in the course of the presentation, go to the chat and put in the questions. Please make sure you put on the slides of Ethiopia, if that is going to be whoever is doing so, either Nicholas or Tam. Please put the slides up. Yeah. Yes. So I'm saying, please put your questions in the chat and register the number of people you have, the people you have at your connection point. We can only see the connection points, but we can't know the people behind them. So we would want to know if you're 3 of you, please write the names of the 3. If you are 5 or 10, please help us know who are the people that are there, so that we keep monitoring these meetings. So back to the Ethiopian team, please have the floor to take us through your quality management efforts in Ethiopia.
Okay, thank you very much. So I'm Habtamu from Ethiopia. I will share you the implementation of quality management system in Ethiopian case. My presentation outline, it starts with background and ends with lessons learned or strengths. As a background, and Ethiopian Public Health Institute has its own vision. So its vision is to be a center of excellence in public health institute in Africa, and has also 3 main missions, mainly to improve the health of the general public through undertaking research on priority health and nutrition issues, and by doing effective public health implementation, emergency management, and establishing quality lab system for the public health investigation, intervention. And then EPHI, Ethiopian Public Health Institute, was formally mandated by the ministry to lead the national laboratory system back in 2005. So the national master plan was developed in 2005 to focus, basically focusing on the HIV lab system. And second master plan also developed in 2009. Its focus was to integrate the public and the clinical laboratory service. And then again, also the EPHI got its leadership, and by using by Parliamentary Act in 2013, it's also given as assignment from the ministry. So currently our third lab strategic plan is also drafted. It will work for 2020 to 2025. It's for 5 years. It's in draft base. So in another case, in our country, Ethiopia has for lab tier system. It has a national, regional. We have to call it also zonal and district level tier system. So we are using our 4 lab tier systems. In general, when we see the laboratory quality management system implementation in the country base, we have more than 400 hospitals and 3,500 health centers in the country. So in terms of implementation of this LQMS in all hospitals and about 375 health centers, we implemented basic quality management system. And then the improvement were also measured using the SLIPTA checklist for our hospitals, and also we use a locally developed LQMS checklist to evaluate and to see the improvements over our health centers. So significant improvement were recorded in all areas, like in all sections in terms of the SLIPTA checklist. And then SLMTA, when you see the SLMTA overview in our country, the program was started or initiated in 2010 after the Maputo declaration. And then the program was also started using by enrolling 23 health facilities or laboratories, mainly the national labs and the referral labs and some specialized hospitals. So the strategies were actually it is a conventional one, a standardized one. That means we have a baseline assessment were conducted, and then there was phase 1, 2, 3 trainings were provided for lab heads and quality officers in each health facilities. So after training, improvement projects were given for those trainees, and then they were expected to do to implement in their health institution. So mentorship were provided in between each training. So finally, the exit assessment were conducted to determine the improvement of the star level. And then after introducing this SLMTA program by enrolling 23 labs, we, as a country, we tried to decentralize the program to the regional level in 2014. So in the region, after we decentralized the program, Ethiopia tried to modify the implementation of this the SLMTA program. Instead of doing the phase 1, 2, 3 training, we tried to customize to a continuous 10 days training. And then the advantages of, in our case, the advantage of doing this was at least a person who comes in the first training has got a chance to complete the whole curriculum, and then we interrupted the defaulter of the trainee, so the trainee can take all the training component at a time. And then sometimes maybe the continuous mentorship, we provided continuous mentorship after the training, and then in terms of cost, it was also cost effective. So currently we are using this type of approach. In general, in terms of enrolling health facilities in strengthening laboratory management towards accreditation, we did 5 cohorts starting from 2010. And as you can see, in 2010, it was 23 labs, and in 2011, second cohort, we enrolled 21 labs. 2013-14, we enrolled 65 labs, and the fourth cohort were 36, and last year we included 45 labs. So in general, 145 labs were assessed and recognized to have a star level. Actually, their status were starting from 0 to 4, and the remaining 46 labs are still under the implementation. We are on that phase, and so we are not doing an assessment for the remaining 45 labs. So after implementation of the SLMTA program, we identified some laboratories who have a good improvement, and then we identified them, and then we applied for ASLM to have an external audit. So in ASLM, In 2013-14, 9 labs were audited, and 2017, 12 labs. In 2018, 12 labs also audited, and finally, in general, 33 labs were audited by ASLM. So the performance were, I think 27 labs were got accreditation, I mean, star 1 to 3 level by the SLM, that means by external auditors, so they certified it. And then when you see the accreditation process in our case, the accreditation initiative, actually Ethiopia started this initiative in 2008 by enrolling, starting to implement in PHI labs, in national labs. It was a Joint Commission International, but we got that it was stringent to accomplish or to get accreditation using the JCI at that time. So as a country level, we were looking for national, regional options to have a stepwise approach. And then laboratories with based implementation performance in lab quality management or SLIPTA supported to move for accreditation. So various trainings where we give them various trainings, and we developed a pool of mentors and auditors together with ASLM and other supporting organizations. So we are also customizing documents that are important and pertinent for the LQMS implementation and for the accreditation program at national level. And central support for equipment maintenance and calibration service were also provided for those laboratories who are supported for accreditation. And then the continuous mentorship were also provided. Regular internal audit training were given, and improvement plan were developed and implemented at those selected sites. Especially as of last 2018 onwards, we focused on 40 labs to register them to register them to have accreditation. And then among those 40 labs, 27 labs were applied for accreditation in our, that means Ethiopian National Accreditation Office. Among them, 90 labs were achieved accreditation within 1 year. Because of our focused mentorship and support. So in general, when we see the overall accreditation status in our case, in the previous years, we have 9 public laboratories accredited. And last year, because of our focused support, we got 10 labs accredited. These are the public, actually the previous one was also public. And then we have also 6 private labs accredited. And then we have another 10 labs already assessed by the accrediting body, and then waiting for the accreditation advisory committee approval to get certification. And the rest 7 labs also, they are already applied, and some steps are already gone, and they are waiting for assessment. So in general, we have total of 25 labs in a country level, 25 accredited labs. So when we implement this accreditation process, actually we face some challenges. Some of the challenges were ownership and support level at management level at various men were not uniform. So there were some ups and downs during the implementation of this quality management system. So some health institutions or hospitals may not take the accreditation program as part of their reform or as part of their routine activities. So that was a challenge. The equipment management, like some equipment were down. So this was also an issue. Inconsistent supply chain management was also an issue, and also turnover of high trained manpower is also a problem in our implementation. In general, our strengths or lessons learned were we understand that dedicated mentorship can increase the efficiency of the accreditation process. Because we say this because in the previous years we got only 9 labs accredited, but last year only by doing our focused mentorship, we have got additional 10 labs accredited, and also we have another additional 10 labs waiting for approval from the accrediting organization. So this comes due to the focused mentorship. So we believe also efficiency can increase by dedicated mentorship. So the other is collaboration and partnership with various organizations like SLM, regional reference labs, and others were critical. And then laboratory forum established. In our case, we have a laboratory forum established, and then during this forum, the accreditation and quality improvement overall the lab quality management system was a standing agenda in each meeting. So this also gives an attention for the ministry and for all stakeholders. So it helps us to move forward in terms of bringing change for quality management implementation. And then local capacity building, PT production. So we start to produce some process testing materials like Gene Expert, TB culture, AFB, HIV rapid testing, AID, and malaria are some of the local PT production capacities in our case. In terms of equipment management, by last year, we have engineers capacity building. So we got NSF certified engineers. So we have in Ethiopia 4 NSF certified engineers. They have the capacity and they have the certificate to do BSc certification. So this was another achievement. So this comes due to the implementation or the need of accreditation and quality management system implementation. And then equipment placement also another thing that we make it. So by using the lease approach, currently this equipment placement will minimize the equipment downtime and the supply inconsistency. So we hope that this placement will minimize the problem related with equipment downtime. So accreditation is also a part of a flagship initiative for the Ministry of Health. So it's a critical agenda currently for the ministry, and this is due to the effort of the National Lab Capacity Building or the EPHI. And then another lessons learned or strengths in our case is the presence of in-country accrediting organization, what we call the Ethiopian National Accreditation Office is, we can take it as an advantage. And the other is the presence of also in-country equipment calibration organization, what we call it, the National Metrology Institute is also our strengths. So in general, these are the few of our journey, our quality journey. So thank you very much for your attention. So if you have anything, you are welcome.
Yes.
Hello?
Okay. Yeah. Thank you very much for that snapshot of the Ethiopian quality management efforts. And as we shared already, that quality is not about the lab. There is quality is embedded in the entire viral load cascade, right from the identification of the patient to the point of providing the care, the counseling, and the follow-up that has to be done on the patients. There's a quality element embedded in there. So I know people have been out there listening, and there are many questions. So somebody monitoring the chat, please, we open up the discussion to the entire members on the call to ask questions.
Okay, thank you very much, Dr. Charles. We have a couple of questions in the chat, but as we read out the questions, if you have any experience to share, kindly put up your hand, and then the moderator will choose you. The first question is from Collins Odiambo, and is asking, when you say lower tier labs may have less stars, e.g. 3-star, are there some quality essentials that need to be prioritized, or an overall score is sufficient? Once again, when you say lower tier labs may have less stars, e.g. 3-star, are there some quality essentials that need to be prioritized, or an overall score is sufficient? Yes, Abtam, you may, Abtam and Anafi, yes.
Okay, let me attempt that. Thanks for the question. I think it's emanating from that pyramid where actually the point here is it is not practical for all the labs in the country to go for accreditation. Remember, sometimes this is a very resource consuming process. So what we are saying is labs are at different tiers. So I think at a minimum, all the labs should be implementing some level of quality. And the country needs to eventually determine which labs really go for accreditation and which go for certification. So in real terms, there is supposed to be sort of some, we are trying to say maybe there could be some regulation within a country to say certain labs should achieve a certain minimum level of quality. Using the example of 3 stars, we are saying labs they actually are conforming to at least 75% of the requirements of the international standards. And obviously that will not be bad. But then if you look at the minimum level, I think on the other pyramid that I showed, that at a basic level, I think labs should ensure that results are accurate and are timely. And then quality control at a minimum is in there. But as in how, at what level the labs should be, I think should then eventually be decided within the country based on available resources. And then obviously when you look at the technical issues, I think needs to be there. But then some managerial issues cannot be easily be achieved at maybe lower levels. But at a minimum, I think we are ensuring a quality result. I think that's how I would put it. Maybe others can add.
Okay, thank you very much. Can we hear from Gesh? Gesh, you had raised your hand.
Hi guys. I think Anafi already addressed it, but just to highlight that in certain developed countries, most of the laboratories may apply for accreditation, but in developing countries, as it's been said, for saving resources and all those things, it is better to focus on the higher level laboratories. Otherwise, it is possible. This is just a recommendation. Thank you.
Okay, thank you very much. The other question is from Nora, and she's asking, how do you motivate private labs to go for accreditation? Do you mentor them, or they have to hire consultants to mentor them? Once again, how do you motivate private labs to go for accreditation? Do you mentor them, or they have to hire consultants to mentor them?
Okay, maybe it's for me. So we included also some private labs for our mentorship. So personally, in our case, we assign our national mentors for those private labs, and then together with the public labs, we support the supports that like provided like public labs. They go to all support, including training, mentorship, and maybe accreditation related fees and calibration related fees also covered by our institute to have those private labs. So for just selected, interested, and committed private labs are prioritized by our institution, and then we move forward to support in all aspects. Thank you.
Okay, thank you very much. Then the other question is from Nora still, and she's asking, is Ethiopia able to train other countries to produce their own panels? Once again, is Ethiopia able to train other countries to produce their own panels?
Yeah, we can train them. If any country is interested to go experience, we can give our experience and we can share for them.
Okay, thank you very much. Then Dr. Gesh is asking, are all the 19 laboratories, they achieved ISO 15189 fully accredited? If so, are they accredited by an international agency? What was the significance of accrediting labs starting by the local ones and proceed to the international accreditation agents? Yeah, there are a couple of questions in this. Once again, are all the 19 laboratories, the ones that achieved ISO 15189, fully accredited? If so, are they accredited by an international agency or your Ethiopian accreditation agents? And then what was the significance of accrediting laboratories, starting by the local ones and then proceed to the international accreditation agents?
Okay, thank you, Dr. Getachew. He was my friend and he was my mentor when he was in Ethiopia. So now, accreditation, let's take National Accreditation Office in Ethiopia. Those 19 labs got accreditation by in-country accreditation office. That means this accreditation is equivalent with the international accreditation as long as this INAO or is a member of the signatory member of the ILAC. That's why, so the accreditation by ILAC and accreditation by SANAS and SARCAS are the same because they all are in the same stage in terms of, they are all members of the ILAC. So we got accreditation by the National Accreditation Office. So indirectly, we got accreditation international. We recognize like that. And the standards also says like that. Thank you.
Okay, thank you very much. On this session, we also have Dr. Dalila from Global Fund, and I know she's a senior clinician. I don't know whether she would want to give us her view on the issue of quality with viral testing. Dr. Dalila?
Yes, thank you. I think that the presentations made today were very, very helpful, quite high level information given. And we see that in our programs, this issue of quality, it kind of makes or breaks a program and viral load testing. And so we know how critical and crucial this is to the implementation and scale up of viral load. And so I just welcome the discussion and the opportunity to hear and listen from the colleagues on the line. I don't have much to add in terms of best practices that we've seen, but I just appreciate the ongoing efforts and collaboration and an interest from the countries. Over.
Okay, thank you, Dr. Dalila. Also, somebody from the community, can somebody tell us what they earn or how they pick it in terms from the community point of view? I see Dennis on and other community members. Is there any one of you who wants to say something in respect to quality when it comes to the community? What is your take on this? Dennis? Mseu? Hello? Are you people hearing me?
Yes,
Hi,
we are.
Yes, we can hear you. I thought your question was directed to members.
Yes, to the community members, to the civil society. I'm seeing
Victoria.
Yes, civil society. Anybody from the civil society? Dennis himself, you're there, and other civil society members. Is there anyone who wants to say the perspective of the civil society when it comes to quality? Yeah.
Okay, I think, yes, Dennis, we are getting you.
If you can come again with the question.
Yes, I'm saying the perspective of the community, of the civil society in regards to quality. Because, okay, the quality spoken out here is so much within the lab, but as I made my opening remarks is that quality stretches from the point of patient identification to communication or to results as well as the care that eventually is given. So you as the people that receive these services, what is your take on quality? Where are the quality flows Are they in the lab? Are they in the communication of results? Are they in the counseling? Are they? What is your take on quality, or what is your perspective?
Okay, my immediate reaction to issues of quality is that traditionally, quality has been associated with the provision of service. So a lot of emphasis has been put on the laboratories and the provider of services in terms of the clinical side. But little attention has been put on the recipients of care. But we appreciate the efforts, the current efforts where the civil society who are part of the recipients of care, they have been taken on board to appreciate what goes on in the laboratories and what goes on in the facilities. So issues of quality improvement, really, I think we have a very big role to play after appreciating what does it take to ensure quality. There, demanding what we know from the provider of services and also from the products that we receive from the laboratories themselves. So I think we in the provider, but from the recipient of care perspective.
Yes, thank you very much. I'm seeing Victoria. Victoria, you want to say something?
Yes, I do. Hello?
Yes, go on, please.
Thank you very much for the presentation, the team from Ethiopia. My question is, how can we as recipients of care or civil society support activities around quality management in the labs?
Yes, good question. So the presenters, do you want to get to the question from Victoria? What do you need from the recipients of care in enforcing or promoting quality?
Yeah, I think it comes at different levels, and it's a very important question, really coming from the recipients of care. I think Dennis mentioned demand. I think for us to really move forward for programs that will really impact patient care at a national scale, I think the recipients of care themselves, I think, should demand at the various level and really advocate for labs that really give results or services to be able to offer them quality assured results. This could be really even advocating for elements of quality to be put in maybe funding mechanisms. That could be one, or just simply educating the society in terms of really getting timely results is part of quality, and really people demanding to get these in time. I think this could be quite broad, but I think it follows within the way I think civil society has really over the past few years moved really faster and more actively in demanding what they rightly deserve. And I think those are my few contributions to that.
Okay, thank you very much. There is one more question. There are a few more questions in the chat, but there is one from Sylvester Kone from ITEC, Cote d'Ivoire, and is asking, how do you manage the transition between SLIPTA requirements to international standard management? Lab staff generally focus on stars and forget that the final objective is accreditation. Once again, how do you manage the transition between SLIPTA requirements to international standards management? Lab staffs are generally focused on stars and they often forget the final objective of accreditation.
Okay, thank you. So in Ethiopian case, basically implementation of SLIPTA and accreditation and ISO, actually end goal is the same. So our end goal is to get accreditation. So we developed a document in terms of following the SLIPTA requirements. So all the requirements stated under SLIPTA, majority of them are derived from the ISO 15189 requirement. So as long as the labs are implementing best or better implementation in SLIPTA, it helps to move directly towards the ISO requirements. So, and it helps them to move for accreditation. So we don't need to prepare additional documents. We don't need to change our SOPs. We don't need to change our quality manuals and the like. And then we change only, and we developed only some requirements, like the accrediting organization may need some requirements in terms of based on their needs. So we changed some few things. Otherwise, in terms of questions, in terms of requirements, majority of them are the same. So basically, because the SLIPTA is derived from ISO 15189 requirements, so we are directly using those SLIPTA documents through the accreditation process. So for us, it helps us. It helps us. So it's not a double effort.
Okay, Livinus has a hand up. Can you say what you want to say as we bring this to a close?
Okay, thank you very much, As, if you can hear me.
Yeah.
Okay, thank you, and thanks to the presenter from Ethiopia. Quite interesting presentations, and also having the opportunity to hear those concerns that other programs in other countries actually have. I think I am happy today that we have individuals from the community who are looking at quality from the end user perspective, because there is always a tendency to advance the narrative that quality only exists from the side of the presenter. But I'm happy that people are beginning to have that awareness and also speaking about quality issues from an end user perspective. So that's quite an interesting aspect. The other contribution I also want to make is that there is the bigger question about whether labs that are not implementing quality management systems should be allowed to even provide services. Again, I understand that each country has regulatory standards with respect to services that are either waived or unwaived, and that determines the package of services that they are expected to provide to the general community. So it's another level of discussion we might want to have in the future, put that on the table for discussion, not at this forum, but it's something that we need to begin to also consider. Quite interesting is the fact that quality, particularly around viral load services that are provided, had really focused on turnaround time, because again, if you have to take a test and you don't get the result at the right time, you're supposed to have that for the clinician to be able to provide care to the patient, then of course, we will be breaching the standards of quality that we have accepted as critical in the services that we provide. So turnaround time is actually a very key component. One of the things I've also observed across some of the labs that have attained ISO 15189 and some of those that have also been accredited is the fact that there is an upward trajectory in terms of number of sites participating in external quality assessments, and that are doing very well as against what we used to have in the past. It clearly shows that we've been having a steady progress towards attaining a level of confidence in terms of the quality of services that we are getting. So I think this is very, very critical. So I'm quite excited that we are putting all of these on the radar, and we are having these discussions to actually drill down and see if there are gaps that have not been met, particularly as it regards to quality management system. One final point I want to make again is we need to also take quality from the lab to the environment. How do the services we provide impact the environment? So this is another thing that we need to begin to look at. I'm speaking particularly about waste management. Thank you very much, Chas and others.
Okay. Yeah, thank you very much. Time is up. We may not be able to take any more questions. The questions that are in the chat can be posted onto the WhatsApp group, and those additional other questions you've not been able to ask, you can ask them on the WhatsApp group, because there we can continue the discussion, and all of us and even the presenters will be there to answer the questions. Otherwise, I want to thank the presenters for that very insightful presentation and subsequent discussion into the issues of quality. Quite intriguing is the question, is the perspective of the community, saying that it is good for them to hear this so that they can demand what they know. So civil society, you are the engine, you are the reason why all of us are there. Please make sure that you can demand, you can push, you can demand to see that not only services are offered, but also that those services meet a certain minimum standard of quality. And as these are public health services, labs especially that are centralized and offering high volume services, really need to have very rigorous quality systems. And I think, as Levinas has said, we may have to discuss what is the minimum requirement of a lab that may be allowed to continue providing public health services, especially in respect to viral load. But there should be a degree, a standard minimum requirement of quality for such a lab to continue offering services. So as I wind up, I remind you that our work that remained unfinished from Addis Ababa, we should be finalizing with the action planning that we had to do. Then the hashtag campaign that you really need to continue to think about. We'll be getting back to you with more leads on the next steps. So please just continue as a team to finalize your action plans. I know you started on that, but you needed to touch base with other stakeholders in country to agree on the focus areas. Our next presentation for next month, we will be giving you the dates and the details, but just to give you in terms of appetizer for you, and also to mobilize others, we shall be having global fund to tell us what is there and what the lab needs to do and the lab folks need to do to be able to get a proper proportion of the funding that is coming through Global Fund to promote lab services, viral load, as well as these action plans that we are developing. So they will be telling us what is in the pipeline, what schedules are there, and when we should be doing what. So that is very important, especially for the lab folks that have always not been involved so much in these country plannings, especially around funding.